Hi, good evening, everyone. Welcome again tonight for our Q&A Wednesdays with J. Lopez, MD. Again, I'm your resident doctor, Dr. Bella, who will be your host today. And I want to tell you all about our topic, which is really amazing for all the females out there because our topic is entitled Age Gracefully with BHRT. Right? So BHRT is bioidentical hormone replacement therapy. We will talk about more we will talk more about female hormones tonight. So for our topic today, our our wellness doctor, Dr. Joel Lopez, will be with us tonight. He has trained He has trained in the field of bioidentical hormone replacement therapy, anti-aging therapy, and regenerative medicine therapy for more than 10 years, and he started his practice in the States. Now, without further ado, let's welcome our wellness doctor, Dr. Joel Lopez.
Thank you, Bella, and good evening to everyone. Thanks
Hi,
for tuning
Doc.
in tonight. Hi, how are
Yeah,
you?
I'm good, Doc. I'm really excited about our topic today because it's all about female hormones. And from what I know, it's not just estrogen and progesterone because testosterone is also important for female hormones, right? And
Yes, that's
it
right.
will be it will be really interesting for all the females out there. So, do you want to start already?
Yeah, let's do that.
Yeah. Okay, so
So, our topic for tonight, like Dr. Bella said, is on aging gracefully with BHRT. So, next slide, please. So, aging, what is aging? So, basically, it's been defined as the progressive deterioration in form and function, which ultimately leads to death. So that's Merriam-Webster definition of aging, and it is quite morbid. However, aging doesn't have to be that way. We could actually age gracefully. And we also need to know the difference between your chronological and biological age. Of course, chronological age is the number of candles you have on your birthday cake, which doesn't change. And there's your biological age, which basically is how your body functions at the cellular level. So this one is even more important. We've seen a lot of clients and we were able to measure their biological ages. It's so surprising because we see a lot of younger people who have older biological ages. And the reason for this is because, again, a lot of factors like poor nutrition and unhealthy lifestyle. So with the therapeutics that we provide, we're able to actually reverse your or a person's biological age. Next slide, please. So anti-aging medicine is otherwise known as longevity medicine, also optimal aging, healthy aging, management medicine, as well as successful aging. So our goal is not only to increase a person's quantity of years, but also the quality of their years. So basically, we want to increase not just their lifespan, but more importantly, their health span. Next slide, please. So causes of aging. Well, there are a lot of different causes of aging. And for tonight, we're going to discuss the neuroendocrine theory of aging. Next slide, please. So before that, we just want to emphasize that we're treating the cause or causes of aging or degenerative diseases and not just their symptoms. Because in conventional medicine, usually symptoms of aging are treated with things that actually cover or treat their symptoms only. So for instance, people who have joint problems are given anti-inflammatory drugs. However, a holistic type or integrative treatment involves the use of an anti-inflammatory or a plant-based diet, as well as the use of supplements such as omega-3 fatty acids, glucosamine, or collagen. People with hypertension are usually treated with antihypertensive. However, a holistic approach involves stress reduction, chelation therapy if heavy metal toxicity is present, as well as correcting nutritional deficiencies, primarily if a person is deficient in potassium or magnesium. Then, of course, another sign, a sign of aging is the presence of wrinkles, which nowadays is being treated with the use of Botox or fillers. However, a more holistic or integrative approach would also involve the use of certain nutrients, such as carnosine, vitamin C, as well as collagen. Next slide, please. And of course, there's memory loss, usually treated with Aricept. However, we know from a holistic standpoint that memory loss could be caused by several factors. For instance, it could be iatrogenic or one that's caused by medications. The most notorious of these ones would be the statins. It does so by lowering your not only your cholesterol, but also your pregnenolone levels. Hormonal imbalance does that. Poor circulation to the brain, as well as neurotransmitter deficiencies, could also cause memory loss. So we address all these factors and able to improve one's memory. Then, of course, nowadays we're seeing a lot of cancer, and the usual treatment for that is chemo, radiation, or surgery. An integrative approach would also involve the use of alkaline or anti-inflammatory or ketogenic diet, the use of immune support supplements or nutrients given orally or intravenously, such as vitamin C, as well as other immunotherapies such as GC-MAF. For autoimmune disease, usually symptoms are suppressed with the use of steroids or chemo drugs. However, in a holistic or integrative treatment would involve the use of detoxification, as well as an anti-inflammatory diet, as well as nutrients. Next slide, please. So before I go to the neuroendocrine theory of aging, one of the most well-known causes of aging is the oxidative stress theory of aging or the free radical theory of aging. What are free radicals? Basically, they're unstable molecules. They have an unpaired electron that actually would cause damage to normal cells in the body. It does so by stealing electrons from normal cells, further causing damage to this normal cells. Next slide, please. So these are things that actually contribute to the formation of free radicals or oxidative stress. The presence of UV light, air pollution, ionizing radiation from medical procedures such as X-rays or CAT scans. Then there's smoking, as well as inflammation and metabolic byproducts. Certain normal physiologic process such as breathing alone could also cause the formation of free radicals. That's why it's really important to take your antioxidants. Next slide, please. So with free radicals, it actually may be the underlying cause or underlying cause of certain chronic degenerative diseases such as cancers, heart attacks, diabetes, dermatitis, as well as aging. So if you want to slow down the aging process, you want to make sure that you get enough of your antioxidants, and you could get that basically from whole foods as well as through supplementation. So next slide, please. Uh, yeah, this just shows you how an antioxidant would donate an electron to a free radical, thus neutralizing it. So that's why it's really important to take your antioxidants, and it may come in the form of vitamins, amino acids, minerals, or even herbal uh, herbal nutrients. Next slide, please. So now for our uh, main topic this evening is the use of BHRT, or bioidentical hormone replacement therapy. The second most well-known cause of aging is the neuroendocrine theory of aging. Basically, we age because our hormones decline and not the other way around. So what are the hormones that decline as we age? They include in women, primarily your estrogen and progesterone, but in both sexes, we see a decline in levels of your testosterone as well, growth hormone, DHEA, thyroid hormone, as well as your melatonin. Next slide. So as I said, we age because our hormones decline and not the other way around. If you see this graph, you would see that estrogen and progesterone remain steady until the age of about the mid 30s in women when there's a drastic decline in these hormones. Uh, Actually, there's a greater decline in progesterone during the perimenopausal stage. So sometimes women in this period of their lives would actually benefit from progesterone. Eventually, they may require both hormones. Testosterone also declines as not only in women but also as men age. So there's a gradual decline in testosterone level, as you can see in that pink line. So it's not as drastic as a drop in estrogen or progesterone that we see. Other hormones such as growth hormone and DHEA, which are both anabolic hormones, also begin to decline, usually at the age of 30. And then there's melatonin, which actually also decline by the mid 30s. This is why people who are actually experiencing premature aging usually have sleep problems or their sleep quality and quantity decline because of the uh, decreased production of melatonin by your pineal gland. So next slide, please. So hormonal changes associated with aging. So hormones that build tissues and improve immunity usually decline with age by 50 to 80%. So that's why we see a lot of infections as well as immune system challenges such as cancer uh, during, uh, during this period. Of course, progesterone begins to decline in women at the age of 30, and that's when they start to experience symptoms of perimenopause, such as depression, PMS symptoms, weight gain, as well as anxiety. This is because of the greater drop in progesterone relative to estrogen, and we call this condition estrogen dominance. Thyroid hormone production and sensitivity also decline as we age. So that's why we see people who have, let's say, issues with fatigue or weight gain when their thyroid hormone is not in the optimal levels. Insulin output also declines and also insulin resistance increases, leading to diabetes. So by the age of 50, people usually have already experienced 20 years of hormonal deficiency. So one of the best things that you could do to slow down or reverse the aging process is to make sure that your hormone levels are at their optimal levels. Next slide, please. So female hormonal imbalance, as I said earlier, estrogen and progesterone both decline during the mid-30s in women. There's a greater drop in progesterone during the perimenopausal years. So it's really important to look at the person's symptoms as well as their levels, and we could do that through the blood, the urine, or the saliva. Next slide, please. So male testosterone, the levels of testosterone declines in women as well as in men. The decline in men is really gradual, so sometimes symptoms are not really that prominent. Sometimes the first symptom of testosterone deficiency could be a heart attack in men. So by that time, their levels are really low. And the levels actually decline by 1% per year, beginning the age of 20. So by the time a person's around 50, their levels could be half of their uh, original or baseline levels. Oh, next slide, please. DHEA also declines as we age. It's actually an adrenal hormone, and it's also important not only for aging, but as well as your immune system health. If your levels are not in the optimal range, it could also lead to problems with diabetes or arteriosclerosis. So it's important to check your levels of DHEA as well. And by the way, DHEA is also important for aging. And finally, we have pregnenolone. I don't think I have a slide for pregnenolone, but next slide, please. So this is the steroid hormone pathway. So all these sex hormones, your cortisol, your DHEA are all derived from cholesterol. So your cholesterol levels have to be at the healthy range. You don't want it too high, you don't want it too low either. So if your cholesterol level is too high, it could lead to cardiovascular problems, and if it's too low, it could also lead to some issues like cancers of the liver or pancreas, as well as hemorrhagic stroke if the levels are too low. So it has to be at an optimal range. It has to be really well balanced. So the first immediate byproduct of cholesterol synthesis is pregnenolone. So pregnenolone is very important for memory. So if your levels are low, it could lead to dementia as well as a lot of inflammatory conditions. So when you're taking statins, it lowers your cholesterol and ultimately it would lower your pregnenolone level. So sometimes people who have memory loss may actually just have issues with the medications that they're taking. So it's really important to look at a person's medication list when you're presented with someone who has memory loss. The second byproduct of cholesterol is progesterone, which actually helps in the formation of your cortisol or the stress hormone. From pregnenolone, you make DHEA, and from DHEA, you make hormones such as androstenedione, as well as testosterone and dihydrotestosterone. Testosterone could aromatize to estradiol, and this is something that we have to consider when we give testosterone uh, in men. So in men, testosterone could actually turn into estrogen, causing problems.
Yeah.
And in women who are taking estrogen hormone replacement, it could also still aromatize to testosterone. So it's really important that you balance everything and not just correct one hormone alone, because our hormones are like a symphony. So if one is off, it actually affects everything. So next slide, please. So growth hormone. So growth hormone is not only important for young people or kids, where its main function is for growth and development. For adults or people in their middle ages, it's really important for repair and regeneration. So by the time you're 30 years old, the levels of growth hormone begin to decline. By 45, it's almost well, not really non-existent, but your levels are really low. So it's really important to correct this hormone problem. Otherwise, people could experience like decrease in heart function, lung function, even problems with their joints. People could have problems with memory. It could also affect their skin, hair, nails, as well as a condition called sarcopenia. It could cause muscle loss. It basically could affect everything. The thing is, it's been maligned. People have, especially in the conventional medical circles, they've uh, they've given growth hormone a bad rap. So even though there are a lot of benefits, people are afraid of using it. But actually, if you work with a doctor who's well versed in age management medicine, then you should be able to experience the benefits of growth hormone. Ideally, the levels or the cost or the price of growth hormone should have gone down because again, uh, people could benefit from this growth hormone, but because of um, politics, the cost of growth hormones remains high. So, things that you could do naturally to raise your growth hormone levels include exercise. So, this is something that you could do for free. It increases your growth hormone secretion by up to 400%. And for those who are less than 50 years old, they may give L-arginine or L-glutamine a try, because this one combined with exercise as well as an alkaline or anti-inflammatory diet could actually help improve your growth hormone levels. And for those who are not responding to this dietary or lifestyle changes, then they may try peptides before trying the actual growth hormone. Okay, next slide, please. So, thyroid hormone imbalance. Yeah, so the thyroid is responsible for metabolism. So, if your thyroid hormone is sluggish, then everything slows down. So, there are a lot of symptoms associated with low thyroid, including weight gain, constipation, loss of the outer third of your eyebrows, intolerance to cold temperatures, even problems with memory, even in kids who have short stature. So there are a lot of symptoms associated with hyperthyroidisms as well, and it's the opposite of hypothyroidism. So basically, we would recommend a glandular form of thyroid because besides T3 and T4, it also has T1 and T2, which are also important for optimal thyroid function. Sometimes we may do a certain, if you could go to the next slide, please. So there are a lot of factors that affect thyroid function. So deficiencies in certain nutrients could actually affect your thyroid. So uh, correction of these underlying deficiencies may actually help improve your thyroid. And problems with conversion of T4 to T3. This happens uh, when a person is under a lot of stress. The hormone cortisol would actually prevent conversion of your T4 to T3. And then, of course, reverse T3 is the inactive form of thyroid. So people who have issues like stress and trauma, people taking certain medications would actually make more reverse T3 than your active form of T3. Certain nutrients such as selenium or zinc would also prevent the conversion of T4 to T3. So it's important to optimize the levels of your selenium and zinc if you want to have optimal thyroid function. And so there. Uh, Next page, please.
I think that's the last, Doc.
Oh, I think, okay,
Yeah.
that's the last one.
Wow. Thank
Okay.
you for your a bit comprehensive topic, but I know there's a lot to talk about
Yeah.
hormones per se. Yeah.
Hmm.
Um, 30 minutes and to 1 hour is not really enough to talk about it,
Yeah.
even to learn about it. It's not enough. So anyway, Doc, I have a few questions.
Sure.
Um, First is BHRT. Is it just for females, or the term BHRT is also for males?
Yeah, actually, BHRT or bioidentical hormone replacement therapy, these are molecules similar to what our body produces. So it's actually being used in men and in women. So we prefer this than your synthetic hormones, which may have a different structure to the one that you produce. Like for instance, equine estrogens that you find in Premarin, this comes from pregnant mares or pregnant horses. So the structure of this hormone is very different from your bioidentical hormones such as
Mhm.
estradiol, estriol, or estrone. So if you have unopposed estrogen use, like for instance, if you're just using Premarin, it could lead to problems such as cancer. And this is what happened
Oh.
in the, I believe, in the late 90s or early 2000s when they stopped the
Mhm.
use of Premarin because of this
Mm.
problem that they
Oh,
encountered. Yeah.
yeah. So you also answered my question. What's the difference between synthetic and bioidentical? So thank you for that.
Hmm.
Next is that who are speaking for females, women out
Hmm.
there. Um, what is who are the women who can take BHRT? Is it 30 age 30 above, or
Hmm.
is there younger than 30? Could they take BHRT? And if they could, what are the conditions that they could
Hmm.
have, for
Yeah.
instance?
So, yeah, women younger than 30 could actually use BHRT if there's a need for it. Like, for instance, women who have estrogen dominance in their teens. So these are women who are experiencing, let's say, migraine headaches or PMS. Usually they have estrogen dominance and they would benefit from some progesterone. Some
Mm-hmm.
women could use certain things or certain nutrients like magnesium or B6 to address these issues. However, if you use the natural progesterone molecule, you'll be able to address a lot of these symptoms. So basically, yes, you could use this in younger women as long as there's an indication and make sure there are no contraindications.
Yeah. Doc, there's a lot of females out there, young females out there who have PCOS or
Hmm.
polycystic ovarian syndrome.
Hmm.
Are they qualified to do
Yeah,
BHRT?
yes,
Oh,
they
that's
can.
good.
Yeah, and actually, women who have PCOS have an underlying metabolic syndrome.
Mm-hmm.
So they have sugar utilization problems. So this is why one of the mainstay treatments for PCOS is the use of metformin, which is something that controls your blood sugar. And of course, they're also given your oral contraceptive pills to also address this. But if you really want to address the underlying cause or causes, you would like to check a person's, again, their blood sugar, insulin levels, hemoglobin A1C, as well as their levels of estrogen, progesterone, as well as their androgens.
Mm.
And
Okay.
it has to be a holistic approach. We don't just give bioidentical hormones. We got to make sure that they're eating properly,
Yeah.
ideally a Paleolithic diet or caveman diet, as well as incorporating lifestyle changes as like getting enough sleep, rest, and
Mm-hmm.
exercise.
Okay. Thank you for that, Doc. I want to ask more about symptoms, primarily estrogen. deficiency and excess of estrogen and also progesterone and testosterone. Just those three hormones to start
Mm,
with. Can you give a few or a couple of symptoms that are associated with those conditions?
yeah.
Start
So
with estrogen dominance.
yeah. So estrogen and progesterone have to be in balance. You cannot give one without the other, ideally. So your estrogen is like we could compare it to the accelerator, and your progesterone would be the brakes. So testosterone has like anabolic properties, so it keeps on telling the cells to proliferate. So it's more of a hormone that has like stimulant properties,
Mhm.
whereas progesterone is the one that puts a brake. So it's more calming or an inhibitory hormone. So people, let's say you have a deficiency on of progesterone, usually may have anxiety because their
Mhm.
estrogen is higher, so it's more stimulating compared to when you have the an equal amount of progesterone or a balancing amount of progesterone. So those two have to work together. If
Mhm.
estrogen is in excess, usually you have low progesterone, and that's when you have symptoms like, for instance, you could have excessive bleeding if you have too much estrogen. You could also have like let's say, too much breast tenderness when you have too much estrogen. You may have PMS symptoms. And of course, there's hot flashes, night sweats. Usually, the symptoms of excess estrogen is just the opposite. That would be low progesterone. So it's really important
Mhm.
to balance those two.
Yeah. So testing really, right, doc, is
Yeah,
important, and
yeah,
follow-up monitoring, not just one initial treatment. That is
yes,
really
exactly.
important.
Yeah,
Okay.
and you being a TCM practitioner, like,
Yeah.
because Bella is actually studying acupuncture and traditional Chinese
Yeah.
medicine, so it's all about balance. In Chinese medicine, it's otherwise known as yin and yang. So,
Mhm.
yeah, it's like opposite poles, but you have to balance each other out. There's like sympathetic and parasympathetic. If you have sympathetic dominance, a person could run into problems such as hypertension, peptic
Mhm.
ulcers. So, the same way, if you have too much yin or too much yang, you also have uh, like vague or chronic symptoms. So,
Yeah.
basically, what I'm saying is that everything has to be in balance.
Imbalance. Yeah.
Yeah.
Doc, I want to go back to your presentation regarding the
Mhm,
hormone pathway. You there's Our body produces cortisol, and cortisol is
mhm,
always associated as the stress hormone, right?
mhm,
So in today's modern world, um, even if I'm sitting here
mhm,
and I don't have like any external factors that keeps uh, keeps my body in a stressful condition, unlike when
mhm,
the in the olden times, right?
mhm,
Our body is producing cortisol when even if my mind is stressed,
mhm.
and that event, the high stress level, could that affect the hormones as well, the hormone metabolism, and instead of producing my sexual hormones, it
Mhm.
diverts itself to producing more cortisol. Is that right?
Yeah, that's true. So it's a condition called cortisol steal.
Mm.
So when a person's under chronic stress, their body would tend to produce more cortisol. And when you have excess cortisol, it actually would compromise the production of other hormones, or like your sex hormones. So
Yeah.
that's one of the things that we look into before recommending the sex hormones. We have to check a person's adrenals as well as their thyroid, because sometimes if there's issues with those organs, it could actually affect sex hormone levels.
Yeah. Because I noticed, Doc, the patients that come to you, they are fatigued, they have hot flashes,
Hmm.
they have weight gain. Those are the common symptoms. Insomnia. Those are the common
Hmm.
symptoms of women who come to you for help. And
Hmm.
you, one of the mainstay treatments that you do, managements that you do, is BHRT for them. And
Hmm.
um, it really helps them a lot. So that's why when I am on at that age, I will also do this BHRT.
Yeah.
Definitely. Okay, um so Doc, speaking of safety,
Hmm.
I'm sure everyone has this question on their mind. Is it safe to use bioidentical hormone therapy?
Yeah, it's relatively safer compared to your synthetic hormones. But
Mm-hmm.
first, of course, we gotta screen everybody. We just don't give BHRT randomly. But if you compare its safety compared to that of synthetic hormones, it's much safer. And we also consider a person's biochemical individuality. So a person's dose, let's say your dose, would be different from a friend's dose, even though you may have the same uh, issues. So we have to consider how you're metabolizing the hormones. There may be times that we would recommend certain foods, such as your cruciferous vegetables, just to make sure that you're making more of the beneficial estrogen. Because
Yeah.
people who have certain genetic defects may have some issues in metabolizing the estrogen. So one of the things that we do offer too is DNA testing. We do a comprehensive panel to find out if a person has some problems with their methylation. So people with methylation issues may have problems with detoxification.
Yeah.
And when you have problems with detoxification, it could lead to chronic degenerative diseases such as cancer or autoimmune conditions.
Okay, thank you.
Yeah.
On again, under safety, are bioidentical hormones FDA approved?
Well, they're natural, so they actually don't need uh, FDA approval. So a lot of natural substances are, how would you call, not really grandfathers the term, but you don't need something that's natural cannot be patented.
Okay.
Yeah, so
So, and we are getting our hormone compa our hormones, bioidentical
mhm,
hormones, from a compounded pharmacy, which
yeah,
who is FDA certified. The laboratory is FDA
yeah,
certified, right?
yeah.
Okay.
Hmm.
So from safety, I want to ask about side effects. Are there
Hmm.
side effects if one undergoes BHRT?
Yeah, there are side effects like anything else. If a person is getting too much of your, let's say, too much of a certain hormone, it could lead to side effects. That's why it's really important to see your doctor on a regular basis, have your levels checked,
Mm-hmm.
and also make sure that you're being monitored on a regular basis.
Mm-hmm.
Um, yeah, so it has to be a holistic approach. You just don't take hormones and forget about your diet or your lifestyle. It has to be an integrative or a holistic approach. Yeah, so anything in excess or anything that's beyond, like not optimal, could lead to side effects.
Okay.
So,
Uh,
yeah.
Last two questions. What are the tests used in your practice doing BHRT?
Yeah, most commonly we check your levels through the blood. But of course, there are other ways to check your levels. It could be done through the saliva as well as the urine.
Mm-hmm.
So there are pros and cons to the use of each specimen. However, the most common, um, at least common test done in the Philippines is through the blood levels.
Mm-hmm.
Yeah,
Okay.
so it's really
And
important to
then
know what your optimal levels are.
Yeah. Uh,
Yeah.
Last question, Doc. How how is the process in having a consultation with you in the clinic for a BHRT consultation? What are the steps so that everyone would know about it?
Yeah, first thing is we send a 14-page questionnaire to find out if there are any issues that could lead to symptoms. And in our practice, we follow these four pillars of health. So basically, the first thing we do is called early detection. So we find out what nutritional imbalances are present, if there are any hormonal issues, if there are chronic inflammation, or if there are heavy metal toxicity. So we do a screening procedure initially, followed by detoxification. Because in our second pillar, uh, we notice that people who undergo detoxification, whether it's at home or in office, these people may usually, their symptoms may usually get better just by doing detoxification. Third is
Mm.
repair. So we do repair procedures through the use of BHRT, as well as services like IV nutritional therapies, hyperbaric oxygen, colonics, EBU, and finally, for our fourth pillar, which is rejuvenation or regeneration, we may recommend cell therapies.
Okay, thank you. Thank you, Doc. I believe we have one question. May you show us? Okay. What is the difference between hydrogen peroxide IV therapy versus ozone therapy? What is the best? Okay, Mr. Lordino, this is actually not a part of the BHRT, but Doc, may
Hmm.
we answer that?
Yeah, sure. So they're both oxygen therapies. Um, they're actually a little bit controversial because they're not FDA approved. However, a lot of doctors worldwide are using these therapies because there are certain laws that allow them to use these treatments. A lot of these have been around for decades, and it's been like hydrogen peroxide, for instance, has been safely used um, by a group of doctors under ACAM, or the American College for the Advancement in Medicine. So it's usually being used for infectious conditions such as the flu. However, they also found out that it's also used to address hardening of the arteries or atherosclerosis. And then ozone therapy is primarily used for the same purposes, and it comes in different forms, such as the hemoperfusion. It could also be given other ways, like through insufflation. So as far as which one is the best, it depends on the person. So that's why it's really important to do a complete evaluation because there are times that we need to do certain tests, such as G6PD tests to see if a person's G6PD deficient, because a person who's G6PD deficient may not be a good candidate for ozone therapy. So again, it's all individualized because everybody's different.
Okay, so thank you for that, Mr. Lordino. And I think that's a wrap for our Q&A Wednesday about aging gracefully with BHRT. So in summary, we talked about the causes of aging. Doc, you discussed about that. And a brief introduction on hormones and the decline of it, right? And
Hmm.
again, our Q&A portion. So I want to invite everyone who to consult with us if you have any hormone symptoms, hormone decline symptoms, which we talked about earlier. And I know this Q&A Wednesday is brief, and there's more to talk about it, and more to talk about hormones, right, Doc?
Yeah.
So
Mhm.
anyway, I want to invite everyone to our clinic to have a consult and see our services and to talk more about hormones with Dr. Joel Lopez. Um, yeah, and we have a website. Please follow us also on our social media account, which is down there. And
Mhm.
I'm Dr. Bella again, your resident doctor here in J. Lopez MD, and our wellness doctor, Dr. Joel. Thank you
Thank you so
for being
much.
with us tonight, and
Thank
see
you,
you again to
Bella.
another Q&A Wednesday. Bye.
Thanks, everyone. Bye bye.